What's up, you guys? It's your boy Miguel giving your daily dose of radiation. Today's video, we're covering the different X-ray exams that require different level of obliques or even angle compensations to be able to get the most optimal images. So to give you context, I am a night shift X-ray tech. I've been doing it for 4 years, work a lot of overtime, so I do dabble in the day shift a lot. So from my experience, there's certain exams. I mean, you're probably, if you've been through school or if you're out there in the field, you have seen that certain exams, depending on the patient's, I would say, body composition or how big they are, you'll have to adjust. So for instance, ribs, depending if you have a smaller patient, it may take less obliques. If it's a bigger, if it's a smaller patient, less oblique. Bigger patient, maybe slightly more oblique, depending on, because like I've noticed that some patients, depending how their fat lays, like, because there's other people who are like wide like this and other people that are like wide from front to back. So it all kind of depends, because like sometimes even with the Y view, sometimes to get it, you may have to be a little bit less rotated on like the more thicker patients. Same thing with like the knees. As we know, the compensation, like the joint, you have to sometimes angle up to get like the joint open. And then what else? With the femurs, that one's a big one too, because like certain patients, like their knees are like really like skinny, and then all the way to the femur, if they're bigger, they have like a bigger compensation, so you have to kind of like throw an angle up there too to be able to compensate for the positioning of, I guess, the anatomy, I guess you would call it. What else? For KUBs, definitely some patients, their belly, their gut, sometimes will hang, like they'll sit straight and then like a large portion of it, I would say patients who are like 300-400, or some that aren't even that big, but they're just like all their stomach or I don't know what it is in their stomach, and they just like will hang to one side. So sometimes like you'll have the board position correctly, but just due to the sear, like the amount of whatever they have, sometimes patients have like ileus or other stuff like that you can, oh my bad, I'm trying to adjust the brightness. You have like ileus and other stuff that will cause their stomachs to be bloated, and it'll just like hang to one side. So you may be centered and you may only get like 75% of the belly. Even with straight positioning, you'll have to like pull the board like a good 3-4 inches to one side where the belly hangs, just to continue seeing all the anatomy. With the bigger patients, sometimes, it all kind of varies on the patient. But yeah, it's been your Miguel. See you on the next one.